Every year, nearly 350 Montanans die by suicide, and more than 200 die due to drug overdose. The rate of overdose deaths in Montana has tripled in the last 5 years, and our suicide rate is consistently twice that seen in the U.S. as a whole. Every one of these deaths is preventable. The community health assessments and health improvement plans developed by local and tribal health departments and their community health partners over the last 10 years in Montana have consistently identified mental health and substance use as top local health priorities. In response, behavioral health crisis coalitions have been formed in communities across the state, bringing partners together to design evidence-based solutions to improve our response systems. Public health departments who engage in and lead this work bring expertise in systems analysis, partnership development, and data-driven decision-making.
Public health's role is so important because we are really a neutral third party. Public health is not a behavioral health provider, but when we are kind of a degree removed from the issues, we can be the one to often pull the right partners together, see the issues that are happening, and figure out how to work together to solve those problems. So we play a pretty important role in figuring out how to improve the system in which behavioral health is being provided in our community.
Partnerships between health, law enforcement, and justice system leaders are critical to the success of this work. Through these coalitions, health stakeholders are forging new and meaningful relationships with justice system partners that have not previously existed.
Get to know your law enforcement, get to know the chief of police and the sheriff, and pull them in as partners in the work.
There has to be a trust. You have to have an individual that is working on a team, a crisis coalition team, that has that relationship in working with the law enforcement.
Glacier County and the Blackfeet Nation are partnering closely to develop solutions that serve individuals both in the county and on the reservation. The Blackfeet Nation has hired peer support specialists who are providing crisis response support and follow-up in the region.
There's always been that invisible barrier between the reservation and Glacier County. And so this crisis coalition has actually bridged that gap. We are partnering with Glacier County Sheriff's Office, the community health, and everybody in between. And that's never been done before.
Officers will be busy doing other, things that pertain to their duties. The EMS will, the firefighters will, but no one is tending to the victim. They're able to dispatch one of the peer supporters, and we go out, we offer our services to the survivors. We offer it to our EMS. It's been very beneficial to have peer support in our community.
Lewis and Clark County has developed a mobile crisis response team that is responding in the community to individuals in crisis. Staffed through St. Peter's Health, the MCRT team is successfully stabilizing 90% of the individuals they respond to on site, preventing unnecessary and costly transfers to the emergency room or jail.
The amount of arrests have gone down dramatically in 3 years. With MCRT, I think it's mostly zero versus it started off with 2 or 3 per month.
Right around 90% of the calls we go on, we're able to keep them in the community. By doing that, we're not making a traumatic experience out of going into a crisis. You're in a crisis, you're already in a traumatic experience, so we're not taking you from your house or your work or your school and then dragging you somewhere you don't want to go.
As this movement grows, more public health leaders are being asked to lead behavioral health crisis work. Here is some advice for those considering taking the leap.
What I would tell other health departments is that we don't understand how big a need it is until we start trying to service it, and then it blossoms and you can see how big a need it truly has been. It could be a rural community, it could be a large community, it's out there.
My biggest piece of advice for other health departments is just be brave and jump in. You can't do this coalition work and the systems improvement work without relationships, so start there.
Engage in your forming of a strategic alliance with key community providers and leaders who can make decisions as soon as possible.
Stay committed, stay consistent. It's a long road. It's tough sometimes and it's frustrating. But as long as you surround yourself with the right people that are all willing to work towards the same common goal, you get the work done.
I believe in Glacier County and in Indian country and in behavioral health that we don't have no more time to wait because people are dying because of mental health.